Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, we have newer diagnostic criteria for SLE. According to the newer diagnostic criteria for SLE, first we have cell-bound complement activation product. In cell-bound complement activation product, we have CBCAP, cell-bound complement activation product. This is actually a newer technique which is used for the diagnosis of the SLE. It is a newer technique used for the diagnosis of SLE based on a bound form of complement activated in the disease. So based on knowing the bound form of complement which is activated in the disease, we can know the diagnosis, whether the patient has SLE or not. So this complement product, that is cell bound complement activation product, so this is because of the activation of the complement. When the complement is activated, then this results in this cell bound complement activated product. Now this complement has a longer half life. So because of its longer half-life, it is exploited in the diagnosis of the SLE, and it is used, this complement which is present, it is used in the form of the to what cells does it bind? That is, it will bind to erythrocytes, or it will bind to the leukocytes, and we also have it can also bind to the platelet bound product also. So it is used in the form of erythrocytes, leukocytes, or platelet bound product. Now among all this, which is the best among erythrocytes, leukocytes, and platelet bound protein? Actually, platelet bound complement protein, which is called as PC4D, this has highest diagnostic capacity. It has the highest diagnostic specificity. Then, so these are newer diagnostic criteria for this. Actually, this is about the cell bound complement protein, which is a newer diagnostic criteria for SLE. Now, then we have other markers are also available. So this is one marker. We have one more marker, other markers. There are some diagnostic markers of SLE are also available in urine. In urine, the diagnostic markers of SLE in urine are, we have endothelin 1, lipocalcin 2, UMCP 2, hepcidin. So these are also the newer diagnostic markers which are seen in the urine.
thank you and thank you for watching.